Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain clinics, physical therapy clinics, and chiropractic doctors. The topic today is responsible opioid management, the 5 methods that pain clinics utilize to be the most responsible that they can be to manage narcotic prescriptions. What's the big deal with narcotic prescriptions in America today? Is it really worth all the congressional investigations, the states cracking down, the DEA looking harshly at pain clinics, prescription habits? The answer is it absolutely is vital and important for that to be happening. The reason is as follows. Between 2000 and 2010, 1 decade, narcotic prescriptions in the U.S. quadrupled. The amount of narcotic overdose fatalities each year is over 15,000, and a recent LA Times report showed that 30 times that amount are the number of people that end up in emergency rooms every year with overdoses but not fatal. So it's about 500,000 of those. So these are incredible numbers that we're seeing, and pain doctors are stuck between, the proverbial rock and the hard place. Back in the 80s and the 90s, the big push was for responsible pain management. The Veterans Administration back in the 90s made a huge push for pain to be known as the 5th vital sign. There were multiple pain societies that came out saying that, narcotic prescriptions were often necessary to help humanely treat pain. But as the years have gone by, with the risk involved, a lot of pain doctors are very wary about increasing medication management when it comes to opioids. So there's a responsibility factor that goes along with trying to do the humane thing. So here are the 5 things that go along with responsible opioid management. Number 1 is what's called a pain agreement. Some call it a pain contract, narcotic contract. Whatever the terminology that's used for it, it means the same thing. It is an agreement between the patient and the pain doctor, which lays out very specifically how the patient-physician relationship is going to work. Now, there are varied components to these agreements, but usually the patient agrees that the pain doctor is going to be the only one prescribing the pain medication. It shouldn't be where patients get Vicodin or whatever narcotic, Percocet, from multiple different doctors, because that can leave the impression of doctor shopping. They're getting the medication, they're using it to sell it, or to barter it, potentially. It just gives the wrong impression. It should be one doctor. The second one is that the patient agrees that they will only take their medication as prescribed. They're not going to continually call up saying, I had a flare-up and I had to take double the amount, so now I need a refill early. That would be a violation of the pain agreement. Okay? Another one is, for instance, if you lose your medication or it gets stolen, you file a police report. Another one might be that the pain doctor is allowed, his office is allowed to call, and you will need to come in within a certain amount of time to get your pills counted and a drug screen performed. Some doctors don't bother with that at all. Another one is usually that you'll agree to some sort of a monitoring system, whether it's drug screening or hair testing or blood testing, to look at whether or not you're actually taking the medication prescribed in the dosage recommended, written for, and make sure there's no illicit substances in the system. It just lays it out there, and it makes a more compliant patient, and it protects the doctor at the same time. That's number 1. All right, number 2 in responsible opioid management is one thing I already mentioned, which is drug screening. And usually it's urine drug screening, and it might be done routinely every time the person comes in, or it may be done randomly. It may be done, I've seen it where a pain doctor will do it baseline, and they'll do it randomly, but they'll also do it if they do a medication dosage change, or the patient's situation changes, such as if they're now on getting their medication refilled early 1 month, those kinds of things. So it really does enhance the compliance of the patient and the trust factor. Now, patients say, well, sometimes they get upset. They'll say, well, I don't think I should be tested. Why? I'm not abusing it. I'm taking it like a... It just puts everybody on a level playing field. There's been studies looking at this. Over 30% of patients either divert their medication, they take illicit substances along with it, and these are people that you wouldn't expect. You know, white-collar executives, looking at all the way to senior citizens who are retired, supplementing their Social Security income. You'd be amazed at what pops positive on these tests. So it just levels the playing field. You shouldn't get upset about it. It's just a normal course of compliance and increasing the trust. Okay. Number 3 in responsible opioid medication management is for the practice to utilize the physician pharmacy database. So when a patient goes and gets a prescription filled, it goes into the database, and the pain clinic can see if they're getting it from multiple different doctors and where they're getting their prescriptions filled. It's another safeguard to basically see our patients doctor shopping, or when they first come in, it can show, you know, if they're coming for another pain clinic and they got let go, if they got let go, were they getting it from multiple different pharmacies? It's not a foolproof system, but it is a responsible way for practices to monitor their patients. Number 4 in the responsibility factor is the quality of the doctors at the practice. Now, do they have to be board certified? You know, probably not, but they should have sufficient training, either with a lot of CME hours or fellowship training, to be able to know the latest cutting-edge ways to treat patients, either with medications or procedures or referrals or in-house physical therapy, things like that. So if they do have board certification in pain management, it gives you that extra sort of comfort factor, knowing that you're being treated by somebody who's been reviewed by their peers, they've done extra training, and they've been given that stamp of approval. Because it's not easy to get, okay, board certification. Number 5 on the list is something that comes out of the report last year from the Institute of Medicine looking at comprehensive pain management. You know, if a practice only does medication management, then they really don't have these other options involved that could help decrease the amount of medications that a person might need. Now, if they're close with physical therapists, maybe chiropractic, or interventional pain doctors, that's a whole different story. But a pain clinic should have options available that include things besides medication management. There you have it, the 5 methods of responsible opioid medication management. I'm Dr. David Greene, the CEO of the Florida Pain Network. Your pain stops here.